Hey, it's Dr. Schiller. In this video series, I am unpacking the Movement Towards Health program. We work through 7 steps to inner healing, and I want to just share how that happens. How does that show up in the program, and why is it so important? So it might be important to you if you're dealing with chronic pain or chronic illness or just the overwhelming stress of living in these times, and you're not getting your needs met by conventional medicine. And that's true for a lot of people. Conventional medicine is great at dealing with acute problems, but if you've got a chronic illness, typically conventional care is not going to help you get at the core underlying processes that are driving chronic illness. We know that chronic illness is, on many levels, a dysregulation of the body's normal healing capacity, an imbalance in the stress response, a shift in the way the neuromuscular system works if we're talking about musculoskeletal pain or bodily pain. So Movement Towards Health was designed to teach you skills that actually reawaken your body's own intelligence about healing itself. So we've talked about these 7 steps of inner healing, and the first one being mindset, the second self-regulation or balancing the stress response, the third is developing compassionate, non-judgmental presence, the fourth is mindful movement, the fifth is visualization or the power of your imagination, the sixth is waking up the healing power of your heart and soul, and the seventh is healing trauma and emotional distress. And this video is going to talk about step 2, self-regulation. What's that about? Basic principle is like this. An unbalanced stress response is a big driver of all chronic pain and chronic illness for pretty much everybody. That's actually fairly well recognized. There's a lot of science to show that that's true. And the issue is like this. Your body learns and practices the way you live. You've got neural networks, your learning process of your brain, your immune system, all the functions of your body happen from experience, especially when it's charged by emotion or arousal. So you've got this learning system, and if you've been learning stress, if you've been learning disease, if you've been learning pain, if you've been learning distrust or fear, that's reflected in your biology. And it's correctable. It's correctable with simple, basic techniques that help you self-regulate. You've got a stress response and a relaxation response. The stress biology is a biology of perceived danger and trying to protect yourself. Relaxation biology is essentially about rest, digest, repair, and heal. So what we do in the program is a number of different techniques that are about shifting from that stress, fight, flight, freeze, protection response to rest and digest and heal. And that's all about shifting biology. It's neurobiology, it's neurochemistry, and it's well documented scientifically. It's well documented that these techniques help do that. And so the issue is not what technique to use. The issue is how to do the technique and how to do it in a way that actually makes a significant impact over time. So simple techniques like just paying attention to your breathing, bringing your awareness to the present moment, watching your breathing, letting go of the tension of your body, going through your body and releasing the tension in your hand and your arms, your back, your neck, your legs, all that. That itself can be deeply relaxing and stimulate the relaxation response. A lot of people, when they try to do that, they're trying to relax. And when you try to relax, you make yourself more tense. It's kind of funny, right? So the whole idea in the program is that we got all sorts of little tools and tricks to help you get around the fact that it's so easy to make yourself more tense when you try to relax. And so it's really about just being present and just like bringing your attention to your breathing, bringing attention to your body. There's other things that we do which are like moving meditation, whether it's walking meditation or moving meditation that's looks a lot like Tai Chi, yoga, synthesized, put together, because that's kind of what it is based on my own experience studying those movement arts and studying rehabilitation science as well as osteopathy and living anatomy. And so there's kind of sitting meditation and there's moving meditation and there's many things in between. And that's how all these things fit together, because those are different parts on this 7 steps to healing, but they all serve to bring you to that place of kind of quieting the system so that you shift towards a biology of relaxation, which is a biology that reduces inflammation and actually helps your body heal. So those are some of the techniques we use. Well, how do you actually do it? How do you make it consistent over time? Because it's one thing to do it once here and there, once a week, something like that. But the main thing is that you make it a regular part of your life. Because if you've been practicing stress and illness and inflammation for 5, 10, 20, or even just 1 year, you got some rewiring to do. And like we talked about, it's about neuroplasticity. It's about experience. It's nerves that fire together, wire together. So when you consistently practice a simple technique, even if you start with just 10 minutes a day, but you do it regularly, and then once you get used to doing it, you do it at other times. I had a conversation recently with one of my patients who had been recently, doing techniques like this to cope with anxiety and fatigue and a bodily heaviness and tiredness he had. And he was doing a good job doing a simple sit down and meditate once a day thing. But I was like, well, are you doing it in your life? And he's like, well, no, not so much. And so the direction was, okay, so when you're waiting for the bus, when you're waiting for the elevator, when you're sitting in class bored by what the teacher's talking about, when you're doing something where you kind of have downtime, you bring your mind to your breathing, you bring your mind to the body, you let go of your busy thinking mind. You can still pay attention to what's going on in the environment. In fact, the foundation of what mindfulness is really about is just being there and paying attention. Because when you really bring yourself to the here and now, your body and your mind relax. It's typically when you're in the future, in the past, regretting, rethinking, calculating, fearful, that's when you generate that stress response. So bringing your awareness to what's going on here and now brings on that self-regulation quality. There's an ironic thing here, right? Because most people think about meditation as, well, let me feel good. But one of the things that I've learned that I share in the program is that sometimes the deepest meditation is when we bring your awareness to what doesn't feel good. If you're feeling some degree of angst emotionally in your body or something physically uncomfortable, and you give it a little bit of attention, and you just acknowledge it, you realize it's there. You just inquire and check in with what the emotions might be. Notice whatever thoughts might be coming up. Maybe you just release a little bodily tension. You just choose to just rest. And that quiets your mind. It quiets your body. It quiets your physiology. So let's just do a 3-minute exercise with this right now, okay? I encourage you to just put all your objects down and just feel your feet resting on whatever they're resting on. Feel the sensations of your butt sitting in the chair. Maybe let your back rest against the chair itself. And just tune into your sensations of breathing. Notice you got an inhalation and an exhalation. You don't have to breathe in any particular way. Just kind of feel the breathing. And notice the way your sensations change as your body breathes in and as your body breathes out. And just let your mind kind of float in and out on your breathing as if your mind's like a cork sitting on the water and a gentle wave's coming in and lifting it up and letting it down. And just letting yourself float on a few cycles of breathing. You can imagine maybe you're sitting by the sea and there's these beautiful waves rolling in. And just be like the sand, receiving that wave of breathing. And then noticing as the wave drains out of the sand, as that breath drains out of your body. And if you have a sense of connection to divine source or spirit or being, then just contemplate for a moment that you're being breathed from the source of life. And let yourself feel that and appreciate. Appreciate that you're being breathed in and it's bringing you oxygen and vitality. And that as you exhale, you're breathing out waste products of metabolism and toxins. And just floating in and out on a couple of cycles of breathing. Great. How do you feel? Leave a comment below this video if you want about how that made you feel. So look, that's one simple technique among the many different things that we do in Movement Towards Health. We do it with structure that encourages you to practice regularly. We have a group program that's not on Facebook. It's in something called Circle. There's less distractions. There's no advertising in there. And it basically, Circle is a community place where we can support each other in practicing, where we can give little rewards for people who practice a lot, where we can troubleshoot together the challenges so that between classes you've got who to talk to, you can reach out to people. You got a community of learners that are learning with you. All of the meditations and practices we do in the live sessions are recorded and they're available 24/7. And that's the basic picture of Movement Towards Health. 7 steps to inner healing to reawaken and help you reestablish the healing intelligence of your body and your mind as a complement to whatever it is that you're doing with other treatments, whether it be sort of natural, nutritional things versus medical care. There's no contradiction here. This is about supporting your movement system and your mind-body system to work together with everything else that you're doing. So enrollment ends at the end of this week. If you're potentially interested, I encourage you to check it out soon so you don't miss out. There's a link that's going to show up on this video where you can go there and get more information. And I'll also put it in the notes of the text. And I encourage you to leave comments if you have any. Like and share this post. And